afternoon, everyone, and welcome to the Superior Health Quality Alliance kickoff. We are so pleased to have everybody join us today. And today I just want to share with you what you can expect from us moving forward as we partner together to improve the health of the communities we serve. So my name is Tisha Looper, and I serve as one of the 3 program directors for Superior Health, and I'll be the moderator for today's call. I have almost 10 years experience in quality improvement and have ventured through assisting multiple settings across the healthcare continuum with their quality improvement needs. To get us started and to ensure we have an effective virtual meeting this afternoon, we kindly ask that you minimize your distractions. We had this same webinar on Tuesday, and we had some background singing from my 4-year-old. So I have removed that distraction for today's meeting. So hopefully we don't hear that, but it looks like my neighbor's out with his leaf blower. So I apologize. I also will try to minimize my distractions. We encourage you all to use the chat function to share your questions, thoughts, and concerns. We actually do want to hear from you. So during today's presentation, if you have any questions or comments, please enter them into the chat box. And finally, we always ask that you give yourself and others as we enter a virtual world and build a network of collaboration and support is to give everybody a little bit of grace. So a few housekeeping announcements. This session is being recorded and we kindly ask that right now you take a few seconds, if you haven't done so already, to please enter your name, organization, and state in the chat. We are so excited to see the broad reach of partnering organizations that we have across the Superior Health region. I know earlier we saw Betty from Wisconsin. We got Tanny from Minnesota. Hello. Wow, they're all coming through now. April from Michigan. So welcome everybody and thank you so much for joining. Most importantly, remember, do not disclose any personal health information if we have any discussions after our slides. And if you're having trouble with Zoom, you can private message Elena Smith using the chat box and she can hopefully assist you with any technical needs. Since all questions today are going to be via chat, please make sure that your lines remain muted throughout the presentation. And lastly, please help us foster a positive learning environment when asking questions and making comments. Remember, we are all here to learn from each other. So here are just a couple pointers on connecting to ensure a solid audio connection. We found that the best quality sound comes from your computer. However, if you have to join via both computer and telephone, please remember to mute both of those. Otherwise, we will get some unwanted audio feedback. And I'm sure as many of you have experienced in your own virtual meetings, to increase interaction among the group, we welcome you to join us using your camera function. And this function is located at the bottom left of your Zoom platform. And in case there are those that are not familiar with the chat box, all interactions and questions will be via chat. So if you don't know, it is also located in that bottom left hand corner sometimes, or up at the top of the ribbon. So finally, our very last housekeeping tip of the day. Throughout today's webinar, you will receive notification to engage in polling questions. We really hope that you participate in these. We want to hear from you. So when the poll is launched, it will pop up on your screen automatically. So please select your answer and then hit submit. Also note, some questions will allow you to select multiple answers, so watch out for those. Now, for our objectives for today's webinar, first we want to make sure that we introduce to you who Superior Health Quality Alliance is, or we refer to ourselves as Superior Health. We want to provide a summary of the CMS National Quality Strategy goals and scope for this initiative that we're all going to be working on together. Deliver an overview of the implementation strategies and educational offerings that Superior Health will be disseminating to everybody. We want to discuss the data approach and Superior Health tools, and identify the next steps. So I know Elena is going to be launching our first polling question. There it is. Have you engaged with one of our organizations in the past for quality improvement efforts? Yes or no? So please take a second to answer that. And now it's officially kicked off. I would like to welcome Tanya Daniels, Superior Health CEO, and she will tell you a little bit about our first objective and who we are.
Thank you so much, Tisha, and we'll be talking about those polling results a little bit later into today's webinar. So a warm welcome to all of you, all of today's participants. I'm Tanya Daniels, CEO of Superior Health Quality Alliance. And I'm proud to lead Superior Health and our team who you'll meet today as we work together to continuously improve our healthcare system. With more than 2 decades of quality improvement experience and through the lens of a physical therapist, I know firsthand the importance of the work you do day in, day out to keep your residents and families safe and healthy. So a big thank you to each and every one of you for your dedication, courage, and strength, especially during these difficult and uncertain times. We know that the COVID-19 pandemic is having an incredible impact to your nursing homes and communities with far-reaching impacts and lessons. Superior Health, we want you to hear today how we are here to support you and your teams. Please reach out and let us know how we can help you. The fact that you are here today is a testament to your commitment and dedication to improving health and healthcare for all. So thank you. A little bit about Superior Health. We formed in 2018. You will see that we are familiar organizations to you that came together to continue our quality improvement across 6 states. So we are 8 organizations. You'll see shortly who that is. We are working together to achieve broad national CMS quality strategy goals with the goal to collaboratively improve the quality of health and healthcare for consumers, patients, clinicians, organizations, and communities. And you'll see that our mission is to improve the quality of health and healthcare through innovation, effectiveness, and efficiency with our CMS contracts, but making sure that they are patient and person-centered and integrated across the continuum of care and services. Our vision is for better health, better care, lower costs, and better healthcare experience with the key values, probably very similar to yours: integrity, innovation, quality, and diversity. And here's a quick visual of who we are across those 6 states. We are 3 quality improvement organizations that were familiar to you through the Lake Superior Quinn, and that is Metastar in Wisconsin, Empro, Michigan, Stratus Health in Minnesota, and 4 hospital associations that have come together through the Hospital Improvement and Innovation Network. So the Illinois Health and Hospital Association, Michigan Health and Hospital Association through their Keystone Center, Minnesota Hospital Association, and Wisconsin Hospital Association. And we're proud to also be engaging our end-stage renal disease network in the Midwest, the Midwest Kidney Network. And I want to just proudly show our Task Order 1 team here. You'll hear several today, but these are how we get together. We have these stand-up huddles and just a really engaged, dedicated, great experience, a lot of clinical and decades of quality improvement experience, enabling us to have an integrated, impartial approach to evidence-based quality improvement that helps deliver better, more efficient care. And I want to highlight that our work and our approach is driven by a strategic imperative to improve quality of care for all of Superior Health. And we've done this by launching our very own Person and Family Advisory Council. The diverse group of patients, resident caregivers, community leaders, and healthcare providers are integral members of our team and will provide guidance on all of our strategies and approaches. You may hear from our advisors during our educational and webinars and trainings throughout this work. We aim to ensure we are doing things with patients and residents and not just for or to them. This will be a thread woven through all of Superior Health's priorities, and I'm so thankful for their partnership. And just in closing, I'd like to thank you again for joining us today. You're going to hear a lot of good information and figure out how to reach out to Superior Health in the best way and the great resources available to you. So we're proud to be on this journey with you. And Elaine, I think we're ready to probably share those polling results.
Thank you, Tanya. Yes, I should be sharing those up on your screen right now. It looks about 2/3 of you have joined our quality improvement efforts in the past, and about 1/3 of you are new to our work. So welcome. We look forward to working with all of you.
I second that welcome. Thank you. And I would like to introduce Kim Mccoy, probably a very familiar name to several of you, Superior Health QIO Task Order Director, and she will dispel what some of those acronyms are that I just threw out there. Welcome, Kim.
Right. Thank you, Tanya. Yeah, it's a mouthful. QIO Task Order Director. What in the heck does that mean? Well, what it means for your purposes is I'm working with a team of folks from Superior Health to design and implement the work that we're talking about today. So like others before me said, we're just thrilled that you're all going to be part of this work with us, that we're all going to be working together to improve quality of care and quality of life for Medicare beneficiaries and others across our region. Just to give you a sense of where I have come from, I've been at Stratus Health in Minnesota, which is one of the member organizations of Superior Health, for the past 9 years. Before that, I worked primarily in health departments. So I came to Stratus Health from the Minnesota Department of Health, where I did a lot of work in quality improvement, community health assessment, emergency response, health improvement planning. And so that's largely the lens that I bring to this work, is that public health prevention and population health approach to quality improvement. So I'm really excited to be doing this work with all of you today. And believe me, we are ready to get started. So the Quality Innovation Network Quality Improvement Organization Program is it's a federal statutorily based program that helps CMS, the Centers for Medicaid and Medicare Services, to implement key elements of the Health and Human Services National Quality Strategy. We also work on implementing federal health reform efforts across the country. So Superior Health Quality Alliance currently serves as the QIO, the Quality Improvement Organization for Michigan, Minnesota, and Wisconsin. And we have counterparts in every state across the country that are doing this same work that we're talking to you about today. So the idea is that, you know, by all of us working together on this national quality strategy, we'll be able to demonstrate big impacts in health outcomes. So as part of this effort, over the next 5 years, actually the next 4 years, we're about a year into it already, Superior Health will engage with beneficiaries, communities, nursing homes, hospitals, clinicians, and others to advance the 5 goals that have been set forth by CMS through 2 priority kind of action areas. So the first area is the Nursing Home Quality Improvement Collaborative. This is specifically designed to assist nursing homes with efforts to improve quality of care and quality of life for people living in nursing homes. We'll do this work in coordination with partners and stakeholders to offer value and hopefully reduce burden on nursing homes and nursing home staff while continuing to support the urgent COVID response that we know has to be a priority right now. The second area is through the Community Coalitions for Improving Care initiative, which will provide you with the opportunity to connect with other healthcare organizations across the continuum of care. So together, with the common goal of improving health and care that's available for everyone in your community, you'll be able to collaborate and share best practices, determine efficiencies by working together, improve patient satisfaction, and hopefully accelerate progress toward other requirements and other reporting that you're doing for other parts of your work. So our goal is really to align this work and make it complementary to things that you're already doing. The 2 priority focus areas that I just talked about will work together to improve the quality of health and healthcare for those community members that I referenced earlier. So for those consumers, patients, clinicians, organizations, and communities. And we'll do that by supporting work in these 5 areas. So improving nursing home quality, which is focused on reducing unnecessary resident harm, reducing hospitalizations, and increasing facilities' 5-star quality ratings. Will increase quality of care transitions through engagement of community coalitions to reduce unnecessary ED visits, increase medication safety. Will increase chronic disease prevention and self-care for those living with cardiovascular disease, diabetes, and chronic kidney disease. Will increase patient safety, including reducing adverse drug events and healthcare-related infections. And then finally, will improve behavioral health and decrease opioid misuse through prevention and access to health services. Superior Health will provide each participating nursing home with regular data reports, education, and training to build capability and expertise. Because of our extensive experience with the state survey process, we plan to help nursing homes meet regulatory requirements. We recognize that changes in payment models are driving changes in the way that work is done, and we're here to help you navigate that structure for your success. We'll offer improvement support that's tailored to meet your organizational needs, and we'll offer this support in a way that's flexible so that you can engage in the best way that works for you. So we also recognize that you have competing priorities, you have a lot of other things on your plate, and so we've really designed this program in a way to make it possible for you to participate in whatever way works for you. Together, with the common goal of improving health and care available for everyone in your community, you'll be able to collaborate and share best practices, determine efficiencies, improve patient satisfaction, and hopefully accelerate progress toward other requirements. We'll supply data to help your group focus on shared areas of improvement and provide relevant national best practices, educational resources, and tools. Through this community initiative, your organization has the opportunity to improve in various areas, including community-based transitions, opioid work, and other related adverse events. Like the nursing home initiative, we'll offer improvement support that's tailored to meet your organizational needs in a way that allows for flexible engagement and participation on your part. So in addition to those 5 goal areas that I referenced earlier, there are 3 cross-cutting themes that span all of this work. And you'll see kind of evidence of those as we go through this work over the next 4 years. So the first one is person and family engagement. This is all about ensuring that patients, families, and caregivers are actively and systematically involved in our quality improvement work. We're going to empower and partner with patients, residents, families, and caregivers to have their stories and learnings incorporated in the healthcare change and quality improvement efforts across those 5 goal areas. We'll be seeking their counsel on a regular basis to guide the design of the improvement work and ultimately the design of our healthcare system. The goal is to improve person and family engagement by increasing patient activation and the global experience of beneficiaries. The second cross-cutting theme is health information technology. So this is all about leveraging innovative approaches with the incorporation of advances in health information technology to drive improvement in these bold goals that we're talking about. This is figuring out how to make the best use of the technology at hand to maximize our impact. And then the third area is vulnerable populations and disparities. So we'll be working to identify and address disparities of care with a specific focus on addressing the needs and barriers of populations in geographically rural areas. As shared earlier, the unprecedented experience of the COVID-19 pandemic has left a long-term impact and lessons for the healthcare community. We intend to build on those lessons as we support you in the ongoing work of the pandemic response. Some of the key lessons that have emerged are that we are all part of one system of care and thus must work together in a meaningful way to improve and adjust the way that we work together and the way that we respond to patient needs. We understand that each of you have different needs and are at different points in this pandemic response. Therefore, as we've talked about a couple times now, participation will really be flexible and tailored to your needs. We really want to make this work for you. We're here to support your priorities, and we will build on and align with existing quality improvement efforts. Thank you all again for being here. We're really honored and excited to be working in partnership with you throughout this initiative. And I'll now ask Elena to share the results of our second engagement poll, which I forgot to introduce a while back, but hopefully you all saw it pop up and responded. So
Thanks.
Elena?
Yeah, so I'm going to share those results right now. It looks like the thing that you're most excited for is that increased patient safety goal, but there's a good mix of everything else in there too. So we look forward to having some events surrounding all of those 5 goals in the near future.
Thanks, Elena. So I'm now going to hand it back over to Tisha to share existing opportunities for collaboration and learning.
Thanks, Kim, and hello again, everyone. I would now like to introduce to you Superior Health's implementation strategies and upcoming educational opportunities to help support you in your quality improvement journey. But before we get started, Elena, could you start our third poll? Great. So the question is, what is your preferred method to receive education? So are you interested in live sessions, maybe something that's recorded, one-on-one education, peer learning opportunities, or interactive e-learning modules? So while you guys are filling that out, I just want to talk a little bit about working together. We all know that quality improvement is not the responsibility of one person. It actually takes a team of people. And Superior Health is here to help support you and your team members to accomplish your goals by working together. Superior Health will provide data-driven approaches to all aspects of this initiative. And Superior Health will provide, design, and implement interventions based on identified opportunities to arm your teams with the resources needed to make the changes. Educational and learning offerings will be developed based on your needs, feedback, and data that we receive. So making sure that you're providing feedback and suggestions and answering poll questions. We really do want to hear from you, and we really will take it back and implement the things that you have all suggested. We want to work together to connect with community collaborative networks in your area and across the 3-state region. We strive to provide a platform for everyone to share their best practices and their lessons learned. And last, about submitting data for quality improvement. As we all know, quality improvement is not officially achievable unless we have data to back up our interventions. So we will work together on submission and dissemination of data and the sharing of data to track all of our progress. In the near future, Superior Health will be disseminating an organizational assessment. The organizational assessments will help Superior Health guide topic development and focus on the implementation of certain activities to meet your quality improvement needs around our focus measures. So based on the organizational assessment and consideration of your specific needs, we'll suggest a strategy for you to achieve your goals. So moving in and out of strategies can be fluid depending on your needs. And I'll talk a little bit more in detail about the movement between the strategies in the next couple of slides. But first, I want to mention that we have so many educational offerings and ideas planned out for the next 4 years for all of our participants. But first, we thought that it would be important to make sure that we all have the right structure and foundation in place to execute, maintain, and sustain quality improvement. So one of our very first educational offerings is going to be the foundational components to support a safety culture. It will focus on creating rapid, scalable, and sustainable change, how to engage and participate in community collaboration and partnerships, and setting a foundation for action and implementation. From there, we'll open up to many other opportunities that are topic and goal-specific activities based on your feedback and based on what we're seeing within our data. But before I move forward with any other educational activities, I want to thank you for sharing what your favorite education type is. And Elena, could you please share the results of that last poll?
Thanks, Tisha. Yeah, so it looks like the majority of you are interested in that live webinar format, but there's a good sprinkling of the others as well. Recorded webinars are pretty popular as well. So thanks for sharing that. We'll have a good mix of all of this in our upcoming work.
Thanks, Elena. I think that's interesting because I think that was the results of Tuesdays as well, was the live webinars. So interesting, thank you. First, before we start getting down the road again about additional educational activities and events that we're going to be offering, I want to introduce to you the Innovative Superior Health Implementation Strategy. We have identified 3 unique strategies to achieve our targeted goals. You can expect our implementation strategies to be organized within 3 main things. 1, independent implementation approach for those that are sort of at your own pace adopters. The next would be an affinity group for those looking to learn from others' experiences and networking with other organizations or like organizations. And the last is structured collaboratives. These are more intense and time-limited learning groups, or I like to refer to them or think of them as sort of as boot camps or trainings around particular topics. So participation is fluid and very flexible and tailored to meet your needs. You may find that your rates or your measurements and understanding of chronic disease prevention and self-care is pretty top-notch, but you always like to read up on the latest hypertension self-management. So for those goals or that goal, you'd want to stick with the independent approach to learn and update yourself and your team at your own pace. However, in today's environment with the pandemic, you feel it's important that you and your team understand trauma-informed care. So you want to participate in maybe an affinity group that is led by an expert in that topic area, and you can hear from other organizations on how trauma-informed care impacted their patients and the care and the quality for their patients, and maybe how they implemented their own trauma-informed care programs. And then lastly, maybe a couple more months down the road, you see an email from Superior Health on a structured collaborative focused on new strategies for successful care transitions, maybe reducing or decreasing readmissions and admissions. And so you sign up. So as you can see, we have really put some thought into helping how you choose your path for participation and learning, and really tailored to your needs and based on what you're going through and your competing priorities. So let's get a bit further into these 3 strategies to see what they all have to offer. So the independent implementation, as I said before, allows participants the autonomy to work on improvement projects. So it gives you access to a whole library of resources that may include, but are not limited to, action guides, assessments, data reports, newsletters, e-blasts, or on-demand virtual learnings. So I mentioned action guides, and so I want to go into just a small explanation of what these are. They're going to be small series of web-based interlinked tools with key strategies for driving improvement and a compendium of national recognized resources. So it's an all-in-one sort of toolkit to help you get started, to update you, to provide you resources on where you need to go if you want to focus on a particular topic. So some opportunities that are coming up under this strategy, as I mentioned before, the independent implementation is going to have a foundational component, so that QI building education, and that will be released soon. In addition to that action guide, there's going to be one based on personal and family engagement and even a community guide. So those are just a few resources that will be coming down the pipe in this independent implementation approach. Next are affinity groups, and these are learning, networking, and sharing opportunities across care settings and even across our entire 3-state region. So affinity groups can be organized in many different ways. They could be organized by organizational setting or a topic or a goal. And at first, Superior Health will launch our affinity groups as we think you may want to see them. But as time goes by, we will look to you for ideas on how you can better foster your networking with other participants and hear your needs, and we will customize the affinity groups to what you're looking for. Affinity groups are obviously, they're regional, but they could be localized if we need to be. They can be time limited, and then they're flexible to participants' needs. Some activities that might fall under affinity groups would be general calls or webinars, coffee talks or discussion breakout rooms, and other great opportunities to network and learn from similar organizations across Minnesota, Wisconsin, and Michigan. So we understand that we've already gone through a lot of moving parts to this initiative. There's multiple approaches to learning events. We talked about the organizational assessment. We talked about CMS measures and goals. And you'll soon be hearing about data submission and data platforms. Therefore, we're really excited to offer in the next couple weeks an open forum call to help with questions to all of the events and moving parts to the Superior Health Initiative. Using the affinity group approach, the orientation to Superior Health will focus on onboarding teams to successfully engage with us and others. There might be things on key metrics and the data platform, how to successfully engage in all of the different learning activities. We could even go into a little bit more detail about what it looks like to participate in the independent implementation, what it looks like to participate in an affinity group, and answer any questions you might have about structured collaboratives. We plan to launch this affinity group in late November or early December, so watch for Superior Health Communications to sign up for that orientation to Superior Health. Next, another activity under the affinity group is our nursing home team has developed an amazing learning opportunity. It's called Frontline Forces. And these are short, on-demand, just-in-time learning modules tailored to the learning needs of nursing assistants. Some of the topics focus on important subjects to help you improve your residents' quality of care. This resource is actually accessible now with more topics planned. Currently, there is content for pressure injuries. It's a 2-part of a 3-part series that are available, and the 3rd part will be available very soon. You can access the Frontline Forces via password-protected webpage, and I believe Elena will be posting that in the chat. And the password for that learning module is called Frontline Forces. So watch for emails with notifications of the new content for that 3rd-part series. So lastly, the structured collaboratives. This is the highest level of technical assistance. So we envision this to be cohorts of structured learning through a tele-echo model. Improvement, be like improvement sprints or a virtual meeting that allows for structured sharing and networking all at the same time. Using the ECHO model, which includes didactic presentations, case studies, and group sharing, all of these combine to help implement proven interventions and assist with tracking and monitoring improvements together. So if you're interested in learning a bit more about the structured collaborative strategy and the ECHO model, our structured collaborative team is hosting an introduction to structured collaboratives and the ECHO model on Tuesday, November 24th at 10 a.m. Central, 11 a.m. Eastern. And Elena will post a link to register in that chat. Now that you've learned a little bit about all 3 of our implementation strategies, Elena, will you please launch the next poll? Thank you. So the first polling question is, what implementation strategy are you most excited about? And the next one is, have you ever participated in an ECHO project before? So as I mentioned previously, our first educational opportunities will be focused on those fundamentals of quality improvement. We'll be offering a great learning opportunity for organizations that are reformulating their quality improvement teams that may have been disrupted via COVID, or maybe there's organizations that don't even have a dedicated quality improvement team offered, and we will be able to help you structure that through a structured collaborative setup and strategy as well. So topics include how to shift your organizational culture toward continuous improvement and how to formulate a quality-driven team, and how to utilize the data you're obtaining while you're working through COVID and beyond. This collaborative will start on December 1st, 2020 and occur weekly through January 12th. We obviously will be skipping the December 29th due to the holidays. So once again, watch for Superior Health Communication to sign up for that fundamentals of QI. Shortly after the conclusion of that particular structured collaborative, we'll be launching another structured collaborative opportunity or event. And this one will allow organizations that want to be at the forefront of change to improve health and healthcare across the region. So through case studies and group sharing, participants will learn how to exercise leadership, to engage, organize, and mobilize partners and stakeholders to strengthen collaboration through the development of healthcare-focused community coalition. So watch for communications for this Learning, Organizing, and Action, or LOA event, right before the new year. And the actual collaborative will be January 19th through February 23rd. So I know that I have shared a lot of information with all of you, so I encourage you to visit www.superiorhealthqa.org to access all these opportunities and to learn a little bit more about them. Just to note, once you access our webpage, you need to go to initiatives. You'll be able to then see all the COVID resources right from that dropdown. And if you want to dig a little bit deeper into the other resources, under the same initiative dropdown, select QUIN QIO. And from here, you'll be able to access nursing home specific resources and activities. And then if you're not a nursing home, all other organizations will select community coalitions to access materials specific to other organizational settings. I would now like to welcome Elena to share the results of our last engagement poll. Elena?
Thanks, Tisha. Yeah, it looks like we got some similar results from our last kickoff call, where the independent approach seems to be what you're most excited for, but there's a pretty good mix there. It seems like everyone's got their own choice of learning style again. And then if any of you have participated in ECHO project, the majority of you have not, but there's a few of you that have before in the past. So we look forward to presenting that to so many of you.
Yeah, it really is an awesome way to collaborate and learn from each other. So thank you, Elena. I'll now hand it over to Michelle, our Superior Health Lead Analyst, to provide an overview of data expectations, submissions, and an introduction to our platform key metrics.
Thanks, Tisha. Hello, everyone. As Tisha said, I am Superior Health's Lead Analyst for the QUIN QIO task order. I am also an analyst on the nursing home team. While I'm located in Minnesota, my fellow analysts and I serve all 3 states. I have almost 14 years of experience with working on healthcare quality improvement in the QUIN QIO world. The objectives for this portion of the presentation is to give you a really high-level overview of the measurement approach, review timelines and data due dates, briefly discuss key metrics, talk about resources for data submission, and introduce future dashboards. The bold goals or measures, as they are now, were mentioned earlier by Kim, so I won't repeat those. I will show you where to access resources for setting specific documents and Encyclopedia of Measures in a couple minutes. Currently, we have about 50 measures, but as the theme for 2020 has been, that is subject to change. We have all been learning flexibility as never before. The data for the majority of the measures will be retrieved by Superior Health using Medicare fee-for-service or nursing home quality data that we receive from CMS. So the majority of the measures, the analysts we have access to this kind of data and we'll be analyzing it ourselves. However, there are a small number of measures that will be reported by participating organizations. So aggregate level numerators and denominators for things like cardiovascular disease, diabetes, and kidney disease will be self-reported by enrolled primary care providers or clinics. Then there's also CDI or CDIF data that is reported by enrolled nursing homes to NHSN, and you can then confer rights to Superior Health. We'll be able to export and analyze the data. If you're not in NHSN for CDI, another option will be able to report that data into key metrics. One measure, the opioid use and prescribing best practice measure, also known as 1.1.4, will be self-reported from clinics, county-based programs, home health agencies, hospitals, nursing homes, and other applicable organizations within the community coalitions. Baseline data for the time period is for the time period September 1st, 2018 to August 31st, 2019, as CMS has prescribed that time period for us. For those of you submitting data for the small number of self-reported measures that I just mentioned, that baseline data will be due to Superior Health on November 13th, 2020. And that data should be reported by month, so not just for the whole year, but like on a monthly basis. Each of the measures have specific improvement targets to reach by the various interim achievement or remeasurement years. You can see the dates for those time periods on the slide. You can see the improvement targets for each of the 50 measures in the Encyclopedia of Measures documents, which I'll refer to soon. Next slide. As I mentioned, the baseline data for self-reported measures are due to Superior Health on November 13th. The next deadline is for the next year's worth of data, which would be September 1st, 2019 to August 31st, 2020, and that would be due on January 15th, 2021. Again, this data should be reported by month. And then once those first 2 years are collected in November and January, after that, we'll collect monthly data, which will be due on a quarterly basis throughout the rest of the 4 years of the project. Key metrics is the system where you'll enter data for any self-reported measures that apply to your organization. Yeah, that's fine. If you missed one of the 3 training sessions we already had, we have a recording available on our Superior Health website. In the recorded overview training session, you will learn how to set up and access key metrics account, enter your measure data, and locate and use any educational tools. On this slide is the link to key metrics where you will be able to enter any applicable data. And Elena already put that link also in the chat. And then once you're on key metrics, I've kind of highlighted on this slide, there's an education and a resources section within key metrics that you can access more information. Once you click on those, the next slide. On the left-hand side of this slide, I highlighted what you can find in the educational section of key metrics. So again, you'll be able to find the recorded overview training session that we have both on our Superior Health website, but you can also access it right inside key metrics. And you'll also, you'll see on this screen that when you do the training, if you just want to look at certain portions, there's like the timestamps of, you can fast forward it to 4 minutes and 5 seconds or whatever it is that's of interest to you. Then there's also a link to a training manual for key metrics. On the right-hand side of the slide, I'm showing what's on the resources section of key metrics. And that's where you'll be able to find setting-specific documents for clinics and nursing homes. You'll find specifications for the opioid best practice measure as well. So for example, if you're a clinic, you can open up the clinic success specification document, and that will show you information about the measures regarding cardiovascular disease, diabetes, and kidney disease. If you're a nursing home, you can open up the nursing home specific document, and that will talk about the one CDI measure that is reported to nursing homes to either NHSN or key metrics. And then below those documents, you'll see the Encyclopedia of Measures or EOM documents for each of the 5 goals that were discussed earlier. And those EOMs give you much more specifics about the measures, like numerator, denominator definitions, exclusions, the data sources. And these EOM documents give information on all measures, not just the ones that are self-reported by the organization. So you can find information about the measures that we pull from claims data or the measures that we pull from the nursing home quality measure data. So all of the measures for each of the goals are within those Encyclopedia of Measure documents. And then besides being our data collection tool, Key Metrics is also the way you will eventually be able to view interactive Tableau reports that we'll have ready later this year or early 2021. You'll be able to view data that either you reported or that Superior Health analyzed from our data sources. You'll also be able to view trend data and comparison data in order to monitor and drive improvement. We will provide training later on so you can learn how to best use the reports for quality improvement. So we'll have that training available once we start to get some data and be able to create the reports for you. Thanks everyone for joining us today. Now I'll turn it back over to Tisha.
Thanks, Michelle. So as we're wrapping things up, we want to spend the next few moments going through some of the next steps. So one thing that we strongly suggest is if you don't already have a quality improvement team set up, that might be one of the top priority things that you want to be establishing at this point. Assess and analyze your own QI needs. While we talked about that we would have an organizational assessment sent out, I would take some time to think about what are, now that you've learned some of the goals and some of the measures, what are some of your needs based upon those categories? And set up a vision and establish an improvement plan. And then be ready to share and submit requested data. So as time goes on though, we'll want to be organizing ways to conduct regular scheduled check-ins with the Superior Health quality coaches, and then studying your results and making adjustments where needed. So, the good old fashioned PDSA. And then ultimately, we'll be talking about improving and how to sustain those improvements and what you have accomplished. Some things you can start working on right now today is work with your IT team to whitelist Superior Health communications and emails. We constantly are getting blocked by firewalls, so maybe talking to your IT team to make sure that our emails and communications are coming through. And add your quality improvement team members to Superior Health distribution lists. If you need anybody to be added, you can provide their email address and contact us through info@superiorhealth.qa.org. And then also be on the lookout for all those upcoming events and activities that we talked about earlier. And the next, I already saw in chat, there was a couple questions about baseline measures. Those are due tomorrow. Please feel free to reach out to us. Not everybody has to submit baseline data. Majority of them are being pulled through claims. So feel free to reach out to us if you have any concerns, and hopefully we can address that at the end of this presentation. So some contact information on how to get a hold of us. Of course, we're available by phone, email, and then if you go to our website, contact us through an online submission form. So now I'd like to take a couple minutes, the next 10 minutes or so, for any questions. Remember to please utilize the chat box function in the Zoom platform to submit your questions. Elena, I did see quite a few questions coming through, so
Thanks, Tisha.
what you
Yeah, I
have.
see. The first question asks, baseline data is due by us tomorrow.
Yeah, like Tisha mentioned, not everybody has baseline data that needs to be due. So it depends on what kind of organization you're with. So yeah, definitely reach out to us with the contact information, and we can get people in contact with you to kind of work with your organization and your needs.
I was going to say, this is Kim. So for, looks like Beatrice and Rebecca, we can make sure that we have people reach out to you to talk about what's needed and to figure out what's feasible for you.
I think that kind of covers those questions that are in there right now. Feel free to add any additional questions within the chat.
Yeah, I think Beatrice asked like a little more specific about which measures are you capturing through claims, and is there a document that lists which ones we must provide? So yeah, the Encyclopedia of Measures that I mentioned, the EOMs that you can access through Key Metrics, it lists all of the measures by goal, and you can, for each of those measures, there's a data source section. So you'll be able to see for those specific measures, which ones we're pulling from claims, which ones we're pulling from nursing home quality measures, which one we're pulling from NHS, and which ones are self-reported. So a lot of readmissions and hospitalizations and utilization and adverse drug events, a lot of those are claims-based measures. And then a lot of the nursing home quality measure data we get directly from CMS. So, but if anybody's a clinic, you can go in and there's a clinic specific document. If you're a nursing home, there's a nursing home specific document. So hopefully those will be able to help you out.
Thank you. I've got a couple more questions now. So what email addresses should be added to whitelist to ensure we are getting all communications? I don't know. What? Anyone know if it's this specific email address? I should be able to actually look this one up pretty quickly.
Yeah, we might have to follow up on that one. I don't think we have any communication staff on.
Christina, yes, we will be sure to follow up with you to confirm the way it shows up through our email server. So I'll be sure to follow up with you, Christina. Thank you for that question.
Thanks.
And actually I just had someone forward me one of our own invitations today. So I just looked that up, and it does come from info@superiorhealthqa.org. This email address right here is who our communications department sends all of our communications through. Thanks for that question, though. And then another question, at some point, will you be describing how you will be reporting the CMS data over organizational types and regional/geographic areas, and how those will be aggregated with the rates that are being self-reported?
I'm not sure if this, Stacy, if you're talking about like the reports that you'll be able to access on Key Metrics. So we're just starting to get to the point where we can design those, and we will have some training, probably, I'm guessing more early next year, later this year at the very earliest. We'll give some training on those reports, and you'll be able to, we'll talk more about how they're created and see, you'll be able to see your data and some comparison data, like whether it's aggregated by a region or like similar organizations. We'll give you more information on a specific training towards those reports. I don't know if that answers your question though.
Okay, so she says how you will be reporting the CMS data. For the measures, I mean, that's all going to be aggregated by measure, right? So we're not reporting any of it by organizations specifically.
Well, I didn't know if she was talking about reports that we're going to share with them.
Right, I was just trying to get at the other possibility, which is how we report the data to CMS.
Right. As far as to CMS, yes, 100% it'll be aggregate by measure.
Yeah.
Yep.
I have a few more questions. Someone asks if we are submitting from MPRO already, is that the same?
This is Tisha. I think I can help with that. So I believe what you're probably referring to is that SNF portal. We utilized that in the last scope of work, and unfortunately, those measures do not align with the new 12 scope of work or this initiative. So no, it would not meet for both.
Thanks, Tisha. Another question, some of the measures, the data source states electronic health record. Do we have to send those?
I'm thinking you might be referring to the self-reported measures that are in goal 3. Those you submit into key metrics, and those are usually gathered through your electronic health record. I can't recall anything that says like it says self-reported data. I don't know that we use the terminology electronic health record, although that's probably where you're getting it from.
Yeah, I would think that that's how you're going to access the data, but please do not send us any patient health information, any direct patient records.
Thank you. And our next question is, can you review again where to log data that is due tomorrow? And I'm going to put in the chat both the YouTube recording and the key metrics homepage, but if you want to explain that a little bit more.
Yeah, so like Elena says, she's going to put the link in the chat, and you can go to that link and you can watch a recording about how to get access to key metrics, how to submit data. And there's also kind of chapter category. So the recording, I think, is maybe 25 minutes, and you can see, you know, if you just want to look at a specific section, like let's say you're already in key metrics and you want to get a refresher on how to submit data and how to navigate within key metrics, you can just go to those specific areas.
And Deanne, because the timeline is so short, if you're not able to access key metrics and get that data entered in there by tomorrow, we could probably figure out how to get that data from you and enter it ourselves. So we can follow up with you again to just make sure that that process is as easy for you as possible.
Thank you. A couple more minutes, so feel free again if you have any additional questions to enter those into the chat and I can read them aloud.
Okay, well, we're almost at the top of the hour and I'm not seeing anything else coming through the chat. So I want to thank all of you for attending today's kickoff webinar. This will conclude our session. The recording of today's session will be shared via Superior Health newsletter channels and emails. We hope you all have a wonderful rest of your day. Thank you so much for attending.